In this knee osteoarthritis series, we've looked at what's happening in the joint and what helps, and today we're focusing on injections, which are often offered but not always well explained. Have injections ever been suggested to you for knee osteoarthritis? Drop a comment down below. All right, so here's what we're going to cover today. First up, we'll talk about why injections are even part of the conversation. Then we'll get into the three main types you hear about: corticosteroids, hyaluronic acid, and platelet-rich plasma. And to finish, we'll tie it all together to look at the big picture, what the evidence really says, and what you can realistically expect.
So let's start with the basics. Why are injections even an option for knee osteoarthritis? Where do they actually fit into an overall treatment plan?
Well, researchers often describe them as a bridge. Imagine you've been doing all the important foundational stuff, like exercise and managing your weight, but you're still not getting enough relief. Injections can step in right there, in that gap, before you'd start considering a major step like a full knee replacement. They fill a really crucial space for a lot of people. Okay, let's dive into our first type of injection, and it's probably the one you've heard of the most: corticosteroids. Honestly, the best way to think about these is like a powerful, super targeted fire extinguisher. So your knee is having a painful flare-up, it's angry and inflamed. The whole point of a corticosteroid shot is to go right into the joint and just put out that fire quickly. Now, when you look at the research, it's actually pretty consistent on this one. Corticosteroids work, and they work fast. We're talking significant pain relief in just a few days. But, and this is a really big but, that relief usually doesn't stick around for very long. The benefits tend to fade after several weeks. And because of that, you'll see that major guidelines typically recommend them for handling those sudden, acute flare-ups, not really as a long-term strategy. Next up, we have a totally different approach. It's called hyaluronic acid, though you might also hear it called viscosupplementation. I know, that's a mouthful. The thinking behind this one is all about lubrication. See, in a knee with osteoarthritis, the natural joint fluid can get kind of thin and less effective. It just doesn't provide that cushion it's supposed to. So the idea with an HA injection is basically to add some extra high-quality lubricant right back into the joint to help it move more smoothly and absorb shock a little better. So here, there's a definite trade-off. Unlike that rapid relief you get from a steroid shot, HA can take several weeks to really kick in. The upside, though? When it works, that relief can last a whole lot longer. Some studies show up to 6 months. This difference is why there's so much debate in the medical community and why different expert guidelines don't always agree on its use. Let's move on to our third category, and this is one that's been getting a ton of buzz in recent years: platelet-rich plasma, or as most people call it, PRP.
Now, this is a completely different ballgame. Instead of an outside medication, this approach uses your own body's resources. They draw a small amount of your blood, put it in a machine called a centrifuge that spins it down and concentrate all the good stuff, the platelets and growth factors your body naturally uses to heal itself. Then, that powerful solution is injected right back into your knee. The goal is to try and harness your body's own healing power.
So, what's the verdict on PRP? Well, it's complicated. On one hand, some studies are really promising, suggesting it could provide longer-lasting relief than both HA and steroids, maybe for up to a year. But the results are kind of all over the place, especially when compared to a placebo. A huge reason for this is that there's no single recipe for PRP. Different preparations have different concentrations of healing factors, which makes it super hard to compare studies. And that's exactly why the official guidelines are still pretty cautious. Okay, so we've looked at three very different options. Let's take a step back and try to put all this research together. What does it all mean when you look at the big picture? This table does a great job of showing the different profiles. You can almost think of them like runners in a race. Corticosteroids are the sprinters. They're super fast out of the gate, but they burn out quickly. Hyaluronic acid is more of a middle distance runner. It's slower to get going, but has more staying power. And then you've got PRP, the marathoner, a gradual start, but with the potential for the most sustained benefit, even though the evidence is still developing. To make this a little more concrete, check out this chart. It's from a study that followed patients for 6 to 12 months, and you can see it right there. On average, the PRP injections led to the biggest drop in pain scores. HA also showed some moderate benefits. Now you might be asking, hey, where are the corticosteroids? Well, they're not on this chart because this is all about long-term relief, and that's just not their specialty. Their impact is really in those first few weeks. But this next part is maybe the most critical takeaway of the whole thing. No matter which injection is on the table, you have to remember these 4 points.
First, these treatments manage symptoms. They don't cure or reverse the arthritis itself. Second, everybody's different. Results can vary a lot from person to person. Third, the science is always evolving, so what we know is constantly being updated. And finally, and this is so important, injections are not a standalone fix. They're just one tool in the toolbox, and they work best as part of a bigger plan that includes things like exercise and education.
And that really leaves us with a big, forward-looking question, doesn't it? As research moves ahead, the real challenge will be to find a balance, to not only get better at managing symptoms in the short term, but to find treatments that can actually change the course of the disease itself. Thanks so much for watching.